All right, my final videos of the day anyway. And remember, the last video is actually the foreign policy video that's already been made. But this is healthcare. I'm going to talk very quickly about healthcare. The McCain healthcare plan, I'm going to start with that. It's very simple. Get a $5,000 tax credit. However, the company does have to pay a tax. You'd think that's going to harm small businesses and medium-sized businesses that have to pay this tax because they will get a tax increase. They will, in fact, get a tax increase. The Obama plan will not give a tax increase. However, the McCain health plan actually provides health care for 27 million people that are uninsured today. We have 47 million people that are uninsured. 27 million of them will get health care right away. Now you say to yourself, well, but doesn't the Obama plan give health care to all 47 of those million people? Well, in fact, that's the attempt. However, we're going to see that that's not necessarily the case. Because for the Obama plan to work, you've got to be employed. For the McCain plan to work, you also have to be employed. So it's kind of a wash there. So basically, the Obama plan, I haven't seen numbers on what he wants to cover. So I'm going to guess it's the same number. But the difference is in the McCain plan, that tax increase for small business is actually cheaper than what they pay for health insurance now. The only difference being that employers that don't provide any insurance will now have to. But you see, under the Obama plan, they would also have to do the same thing. So both plans basically force the small business guy to create an insurance plan. So the McCain plan, however, because it's a tax credit, that actual credit is actually something that employees pay to the health insurance company themselves. They then get it back in their taxes the following April. What that does is it provides the government the company and the employee pay into the health benefits. The employee gets the taxes back in his income the following April, and the small business guy actually pays less money in this tax because the employee is joining with him than the employer pays now. So it's actually cheaper for the small business owner, the medium-sized business owner, than his current insurance plan costs him now. The insurance company gets their money. The federal government essentially is left out of it. And the insurance companies get their money. So it's a win-win-win situation for everybody involved. Now the problem is that during that year, yes, the businesses and the employees are paying for it, which they're not doing now, but they get that back at each April. So, and by the way, it's a tax, so the government actually does receive some tax benefits. Under the Obama plan, the tax benefits are all on the onus of the government. They have to pay for everything, which further reduces the deficit, which further hurts programs like Social Security and Medicare. Folks, we can't afford that. We can't afford to put more people at risk in this country for paying a huge debt off. We cannot do that. The McCain plan does not add debt to the federal bottom line. The Obama plan does. And each plan covers the same people. The only difference is that now that the federal government is not on the hook, our future generations are not on the hook. In the Obama plan, they are. So, by and large, when we just take the basic premises of the health care, there are a lot of other issues for each health care plan that you can talk about that are pluses and minuses for each candidate. But this is the main part of each person's health care. And the main part is that the McCain plan covers these people. The Obama plan is more questionable. And if his plan does cover people, it puts more and more onus on the federal government. The McCain plan does not. So John McCain has the superior health plan. John McCain has the superior economic plan as well. And the last thing I'm going to talk about, I said this would be the last one, but there is One other thing I want to talk about, and I'm going to talk about it in my next video. It's a very short thing and it's very important, so stay tuned for that.